next speaker is Dr. Zain Khatib here. It is his paper on impact of novel iSMART software on topography guided LASIK outcomes.
Thank you, AIOS, for this opportunity. So I'm going to be speaking on a software that I have developed and the results of this software. So we all know that topography guided LASIK for the Wavelight platform acquired FDA approval in 2016 to treat virgin eyes. The problem arises is when the anterior corneal cylinder is very different from the refractive cylinder. And then what exactly to do for topography guided LASIK is unknown. Some papers have published that you treat the manifest cylinder, while other papers have published that you treat the topography cylinder. So there was a software called the 4CDs software, which kind of took vector mathematics to calculate the difference between the two. So the aim of our study is to evaluate the outcomes of topo-guided LASIK using a new software that I have developed as compared to treating the manifest refraction alone. And my software is also based on vector mathematics and geometric optics, and it is similar to the 4CDs software. So this is how my software looks like. Once you enter all the data, the software automatically gives you what is the astigmatism coming from all the individual components of the eye. And then it will tell you what is the final refraction that you have to feed into the machine in order to proceed. So it was a single center prospective randomized trial of Contura topo-guided LASIK using two methods. We included 90 eyes of 45 patients, and the first eye underwent treatment using conventional manifest refraction, while the second eye was planned using the software, and the modified refraction given by the software was entered into the system. And the eyes for a particular group was assigned by simple randomization. It was a single surgeon femtoflap with Wavelight EX500, and Topolizer Vario was used to capture Contura images. Post-op analysis of everything was done at 3 months, and we excluded hyperopes, high refractive errors, unreliable readings, presbyopes, and any complication. We validated the study with the standardized graphs and charts given by JRS and JCRS. So these were the results. You can see both the groups, since they were from each eye was from a similar patient in terms of age, gender, pre-op, sphere, cylinder, pre-op spherical equivalent, they were all similar. Ocular residual astigmatism, which is ORA, which is something that is important. It's the vector difference between the manifest and topography cylinder. That also was similar in both the groups. So there were no differentiating pre-op factors. What we saw is in the control group, the mean post-operative uncorrected visual acuity in decimals was significantly worse as compared to the study group, and this was statistically significant. When we look at the uncorrected distance visual acuity, 6/5 or better vision was achieved in more patients in the study group, that is 60% patients in the study group, while as 44% patients in the control group, although none of these were statistically significant. But if we look at the percentage of eyes gaining a line of visual acuity post-op, we can see that in the study group, 42% patients gained one or more lines of visual acuity, whereas in the control group, 22% eyes gained one or more lines, and this value was statistically significant. If we look at the post-op residual cylinder, we specifically studied cylinder because cylinder was an outcome that was very variable since we were changing it. So in this also we see that 100% eyes were within plus minus 0.5 diopter residual post-op cylinder compared to 89% eyes in the control group, and this value also was statistically significant. If we look at the post-op spherical equivalent, again the study group had better outcomes, but this was not significant. So, our study is based on a software that I developed. So we did a direct comparison with the 4CDs, which is also a third-party software. And you can see the outcomes are relatively similar in both these studies with in terms of percentage of eyes gaining good vision. So in our experience, Contura topography guided LASIK using the iSMART software yields superior outcomes as compared to treating manifest refraction alone. And the cylinder correction definitely seems superior with the software, and our outcomes are similar to the 4CD's analytical engine, which is already established. Thank you.
Please explain what you do differently in this case compared to the other software. It is the same thing you are doing.
Yes, sir. So it's basically a software which uses vector mathematics to analyze the corneal cylinder which is coming from the anterior cornea. It also considers the cornea from the astigmatism coming from posterior cornea. It calculates the total astigmatism, which is the refraction of the eye we feed in. Then by vector mathematics, it calculates how much is the astigmatism coming from the internal astigmatism, that is from the lenticular astigmatism. And then it takes an average of all these three and gives you the final.
It's already there, no?
Yeah, it has been made by me. I have coded the software for doing this.
Thank you. Sorry.
Are you going to plan a patent for this? Have you got it approved by some?
No, ma'am. Actually, the thing is that this is a very niche topic. Not, many people have much application for it. So it's not something that I'm patenting. It is just that if anyone, wants it or is interested, I can just give it to the person free of cost, as long as they are.
And just
understand.
quickly, like, what was your journey? How long did it take you to do this?
It took me about a year.
Yeah.
Yeah, it took me about a year. So it's actually I was very keen on the Forsides analytical engine, which was supplied to a lot of doctors in India. But after a point, they stopped giving it to India. It is made by Dr. Mark Lobenoff in US.
Yeah.
So he was not allowed by Alcon to give the software after a point to Indian doctors. So because I wanted to do it, I started my journey of trying to make it myself.
And have you done a comparative on both the platforms as to?
So I don't have access to the 4CDs, but my colleagues who have it have compared, and you get very similar refractions that you put in using
Yeah,
both
so
the
maybe
softwares.
the next step would be to do a comparative now, because then you have a win-win situation when
Right.
you have all the data
Right.
and you calculate your sensitivity and specificity, and if your software is as good and is coming without a cost,
Yeah.
then that's really a very remarkable innovation.
Right. So I did put the comparison of the two studies which were published,
Yeah.
and in terms of outcomes, both seem quite similar.
Yeah. Congratulations.
Thank you.